Hey mamas, so in this video we will be discussing whether it's safe to travel during your pregnancy and when should you stop traveling. It looks like many doctors and OBs are okay with you flying under certain conditions. As long as there are no identified complications or concerns with your pregnancy, it is considered generally safe to travel during pregnancy. And the ideal time to travel during pregnancy is usually in the second trimester, because in most cases you are past that morning sickness phase and several weeks away from the third stage of pregnancy when you are more easily fatigued. Is it okay to travel by air? Traveling by air is considered safe for women while they are pregnant. However, the following ideas might make your trip safer and more comfortable. Most airlines allow pregnant women to travel through their 8th month. Traveling during the 9th month is usually allowed only if there's permission from your doctor. You need to have that medical note. And most airlines have narrow aisles and smaller bathrooms, which honestly makes it more challenging to walk and be comfortable when using the restroom. Because of the potential of turbulence that could shake the plane, make sure you are holding onto the seat backs while navigating through the aisles, mama. And you may want to choose an aisle seat which will allow you to get up more easily, to reach the restroom, or just to stretch your legs and back. Because also you want to avoid blood clots, and traveling by air can increase that risk. So be sure you're standing, walking around, and moving your body so you do not get a blood clot. You might want to travel on major airlines because they have pressurized cabins versus the smaller private planes, because if you do ride on one of those smaller planes, you want to avoid altitudes above 7,000 feet because there is a risk of further blood clots in your body, and so you want to make sure you're wearing compression stockings as well. The Royal College of Obstetricians and Gynecologists and the International Air Travel Association recommend that expecting mothers in an uncomplicated pregnancy avoid travel from the 37th week of pregnancy through birth, and avoiding travel from 32 weeks through birth is recommended for those women who have complicated pregnancies with risk factors for premature labor, such as carrying multiples or having a risk for preeclampsia because of high blood pressure. Other risk factors that warrant travel considerations including the following, which is severe anemia, cardiac or respiratory disease, a recent hemorrhage, current or recent bone fractures. And so you might want to keep track of this, mama, and if you have any of these listed, please discuss with your doctor before booking a flight. Traveling by sea is generally safe for women while they're pregnant because there are really no reported risks other than that rocking motion, which might make you feel nauseous all over again. But you want to make sure to check with the cruise line to ensure that they do have a healthcare provider on board in case there are any pregnancy complications. And you want to review that route and port of calls to identify if there are any medical facilities if needed. Make sure to check if any of your medications for seasickness are approved for women, and if they are, go ahead and carry it on board and use them because you want to avoid nausea and vomiting. Now let's talk about international travel during pregnancy. So traveling overseas has the same considerations that local or domestic travel has, but it also has concerns that you need to know about before making an international trip. So let me help you assess whether an international trip is good for you at this time in your pregnancy. First of all, you need to talk to your doctor before you take an international trip to discuss the safety risks factors for you and your baby. You also want to discuss immunizations with your healthcare provider and carry a copy of your health records with you. During international travel, you may be exposed to a disease that is rare here in the US, but is very common in the country you visit. So make sure you contact the Center for Disease Control and Prevention or visit their website to receive a full safety information along with immunization facts related to your travels. And diarrhea is a very common concern when traveling overseas because you may not be used to the germs and organisms found in the food and water of other countries, which can lead to a problem of dehydration during your pregnancy. So let's talk about some tips to avoid diarrhea and help keep you safe. You want to drink plenty of bottled water, used canned juices or soft drinks as an alternatives, and make sure the milk is pasteurized or just avoid the milk in general. Avoid fresh fruits and vegetables unless they have been cooked or can be peeled, like an orange or a banana, and make sure all the meat and fish has been cooked completely. Please do not eat raw meat overseas. There is a risk of those meats carrying bacteria that will cause you or your baby to come in contact with an infection, so you just don't want to go there. So again, mama, let's do a recap. Whether you are going by car, bus, or train, it is generally safe to travel while you're pregnant. However, there are some things to keep in consideration that could make your trip more safe and comfortable. It is essential to always buckle up every time you ride in a car. Make sure that you use both the lap and shoulder belt for the best protection of you and your baby. Keep the airbags turned on. The safety benefits of the airbag outweigh any potential risk to you and your baby. Buses tend to have narrow aisles and small restrooms, so this mode of transportation can be a bit more challenging. And so the safest thing to do is to remain seated while the bus is moving. And if you must use the restroom, make sure to hold onto the rail or seats to keep your balance. And trains usually have more room to navigate and walk, and the restrooms in trains are usually small, so it's also essential to hold onto rails or seat backs when the train is moving. And try to limit the amount of time you are cooped up in the car, bus, or train. Keep travel time around 5 to 6 hours. Use rest stops to take short walks and do stretches to keep the blood circulating to avoid blood clots. Again, dress comfortably in loose cotton clothing and wear comfy shoes. Take your favorite pillow. Plan for plenty of rest stops, restroom breaks, and some stretches. Carry snack and foods with you. If you're traveling any distance, make sure to carry a copy of your prenatal records and just enjoy the trip and have fun, mama. And again, check with your doctor to make sure traveling is safe during your pregnancy.